Hi, this is Don McLeod from Brampton Focus, and we're here at Williams Cafe. Today we're going to be talking about healthcare in Brampton. We have a fully functional hospital, Brampton Civic. Peel Memorial doesn't have a functioning ER, and we need a third hospital in Brampton. So Sanjay, you had a problem with your father at Brampton Civic. Tell us a little bit about what you encountered with your father and dealing with the healthcare system at Brampton Civic.
Sure, thanks, Don. So this was back in December, 11th of December to be exact. My dad had a mini stroke, and he was rushed to the Brampton ER. And for the first day, he had to sit on a broken wheelchair for almost 14 hours. It's at this point that I became aware of this concept of code gridlock, which actually was being announced on the PA system at the ER, saying, attention all staff, this hospital is now under code gridlock. Just to give a quick definition of what it is, basically the ER is not able to handle the volume of patients coming in because it was designed for only 218 per day, but in the winter months, the hospital expects to see at least 375 to maybe 450 patients. So that was my first experience at the ER. Dad was in the ER for 3 days, and they discharged him, and without actually treating him. And we brought him back home and found he couldn't stand or walk. And since the hospital had not actually checked if he could stand or walk, then they did not put him into the system, for home assessment and personal support workers and so on and so forth. So I had to initiate these processes myself, which meant I had to go through the routine waiting list, several weeks of wait time for the home assessment, and then several weeks to actually be assigned a personal support worker.
So part of this situation that you went through, you'd like to impart to other people. I know you're working on something going forward to help other people that go through this situation. What are you trying to do in the long term for advocacy?
A good question. So basically, this was a really bitter experience for me. And I figured there's other people in Brampton who must be going through the same. But people are busy with their lives, and they don't necessarily find time to actually speak up. We need our local politicians, our MPs, our MPPs, and even City Council to step up and ask for what Brampton needs, because there is a sense that nobody really cares. The government hasn't been allocating the appropriate funding. Clearly we needed a third hospital, and there was a motion raised by the NDP in October of last year, and our local MPPs did not even attend that vote. So this needs to stop. I mean, a code gridlock, I hear, has been going on for several years. One of the hospital admins actually said to me, when I asked how often does code gridlock occur, they said that it occurs once a week. But I was there with my dad, for the second time in the hospital when he passed away. He was there for 2 weeks. And every single day during those 2 weeks, I heard on the PA system, this hospital is under code gridlock. So what I've learned since then is that the Brampton ER is the busiest in the country. And the hospital is always under code gridlock between December and March. Mostly because of the flu season and a lot of seniors fall sick. But regardless of what the reasons are behind the code gridlock, what we need to do is solve this problem. There are people who are suffering in hallways, and there are people who just don't have the time to raise their voices to their MPPs or city councillors. So somebody needs to step up and then speak on behalf of all these people. So what I'm actually planning to do is start a website where I'll begin by sharing my story, my dad's story that got me started as being a self-appointed healthcare advocate for the city of Brampton. But what I wanted to do is allow others in Brampton to actually express, share their stories, and then maybe as a community we can come up with proposed solutions that we can then take to our local politicians and say, we elected you for this reason, go fight for this cause and make healthcare better in Brampton.
So thank you, Sanjay, for that, because that's it's a situation that most people encounter in Brampton. It's an unfortunate situation, and as you mentioned before, our local MPPs don't seem to be doing much. So we're going to keep track of when you launch that website as well, and we'll be advocating on your behalf to make sure that people know where they can go and where they can post their stories, and hopefully put pressure on our local politicians and our provincial politicians to get something done to make sure that we have a second functioning hospital as well as a third hospital. So thanks, Sanjay, for that.